Hi, my PowerPoint is over prenatal development and birth. My name is Madison Durno. There are two main types of genetic disorders that are transmitted through recessive or dominant genes: autosomal disorders and sex-linked disorders. Autosomal disorders are caused by genes located on the autosomes, while sex-linked disorders are caused by abnormalities found on the X chromosome. Autosomal disorders can either be dominant or recessive. Dominant autosomal disorders can be inherited from only one parent, and that parent is usually not just a carrier, but is also affected by the disease. Usually, when one parent has the normal gene and the other parent has the abnormal gene is dominant over the normal one. Huntington's disease, Marfan syndrome, tuberous sclerosis, and von Hippel-Lindau syndrome are examples of autosomal disorders. Autosomal recessive disorders require both parents to be a carrier of the gene, and frequently neither parent shows signs of the recessive condition. The chances of a child born to recessive carriers actually exhibiting signs of the disorder are just 25%. Cystic fibrosis, sickle cell anemia, phenylketonuria, Hartnupp's disease, Carter-Jenner syndrome, galactosemia, and Cora's disease are all examples of autosomal recessive disorders. PKU symptoms include mental deterioration, hypopigmentation, blonde hair and blue eyes, and mousy body odor. The treatment for PKU is to remove phenylalanine from the diet by avoiding foods that contain high amounts of the substance. Sickle cell anemia symptoms include anemia, episodes of pain, painful swelling of the hands and feet, frequent infections, delayed growth, and vision problems. Normal red cells are flexible and round, while sickle cells are rigid, sticky, and crescent-shaped, blocking blood flow in the arteries. The only potential curative treatment for sickle cell anemia is a bone marrow transplant, also stem cell transplant. Because this treatment is risky and finding a donor is extremely difficult, treatment of sickle cell anemia is usually focused on relieving negative symptoms as they occur. Cystic fibrosis symptoms include persistent cough that produces thick mucus, wheezing, breathlessness, exercise intolerance, repeated lung infection, inflamed nasal passages, foul-smelling, greasy stools, poor weight gain and growth, intestinal blockage, and severe constipation, because straining when constipated can cause a rectal prolapse. This may be a sign of cystic fibrosis in children. Since there is no cure for cystic fibrosis, treatment focuses on reducing symptoms and avoiding additional complications. Common goals including preventing and controlling lung infections, removing and loosening mucus from the lungs, preventing intestinal blockage, and consuming adequate nutrition. Dominant autosomal disorders usually appear in every generation as children have a 50% chance of inheriting the disorder, even when only one parent is a carrier of the abnormal gene. Huntington's disease symptoms include movement disorders like involuntary jerking or writhing movements, muscle problems such as rigidity or contracture, slow or abnormal eye movements, impaired gait, posture, and balance, difficulty speaking or swallowing. Cognitive disorder symptoms include difficulty organizing, prioritizing, or focusing, lack of mental flexibility, lack of impulse control, lack of awareness of one's own behavior and abilities, a slowness processing thoughts, and difficulty learning new information. A psychiatric disorder symptoms include feeling of irritability, sadness or apathy, social withdrawal, insomnia, fatigue, frequent thoughts of death, OCD, mania, and bipolar disorder. Huntington's disease has no cure, and therapies include various medications as well as therapeutic interventions to monitor and manage symptoms proactively. Symptoms of Marfan syndrome include tall and slender build, disproportionately long legs and arms and fingers, a breastbone that protrudes outwards or dips inward, a high arched palate and crowded teeth, heart murmurs, extreme nearsightedness, abnormally curved spine, and flat feet. Marfan syndrome has no cure. So treatment is focused on monitoring and management of complicating symptoms. Although people with Marfan syndrome in the past frequently died young, proper management of the disorder in modern medicine have made this a livable condition. Sex-linked recessive disorders usually refer to an X-linked recessive diseases that most often occur in males, since males have only one X chromosome, so that a single recessive gene on that X chromosome will cause the disease to manifest. Fragile X syndrome, hemophilia A, red-green color blindness, Duchenne muscular dystrophy, and Becker's muscular dystrophy are all examples of X-linked recessive disorders. Fragile X symptoms include intellectual disabilities, ADHD, anxiety, unstable mood, autistic behaviors, sensory integration problems, speech delay, and seizures. Physical signs may include a long face, large prominent ears, flat feet, hyperextensible joints, low muscle tone, and males may have larger testes after puberty. There is no cure for Fragile X syndrome, so treatment is focused around education, therapy, and medication to confront the symptoms that interfere with a normal life. Some symptoms of hemophilia A include unexplained excessive bleeding, many large deep bruises, unusual bleeding after vaccinations, joint pain, swelling, and tightness, blood in your urine or stool, and unprovoked nosebleeds. Clotting factor replacement is the main treatment for hemophilia A, and various medications can be used to help stimulate the body to produce more clotting factor and preserve clots from breaking down.